everyone, welcome back to Causality with Boris, broadcast from Sobolev Spaces. In this video, I'm going to talk about causal diagrams. What's a causal diagram? It's a dependency graph that shows direct and indirect influence of treatment and outcome. I will cover in detail other relationships that may exist between them, and then I will talk about directed acyclic graphs. Here is the basic structure of a dependency graph. Two nodes connected by one arrow. Let's designate one node for treatment and another for outcome. And arrow between them represents direct influence. Treatments can influence outcome indirectly too, through a chain of dependency. We used this term before. It's time to talk about causal paths. I define causal paths as a tail-to-head sequence of arrows between treatment and outcome. They look like this diagram. Causal paths start at the treatment node. They only contain arrows pointing away from treatment, and they end at the outcome node. So it only makes sense to talk about causal paths between the nodes representing treatment and outcome. Causal paths can take the form of a direct, immediate effect. There is only one arrow between treatment and outcome. In other words, changes in the treatment node alters the outcome directly without intermediary. Causal paths can also take the form of indirect, mediated effect. Part of the treatment influence on outcome comes through changes in intermediary nodes. Mediation is effectively a chain of immediate effects. Mediated effects often represent a hypothetical mechanism of causation. In our running example, we compare hospital mortality by timing of hip fracture surgery. Two mechanisms may mediate the effect of delays. First, prolonged immobilization. Clinically, we know that immobilization may lead to potentially fatal complications, such as pulmonary embolism and pneumonia. The second mechanism is prolonged exposure to inflammation and hypercoagulation states. These can lead to stroke and myocardial infarction. We say these complications mediate the connection between delays and death. Just one more thing. Mediating factors are post-treatment conditions. In a sense, there are two outcomes of treatment. Causal diagrams contain two kinds of paths between treatment and outcome: causal and non-causal. Causal paths always have a direction from treatment to outcome. Non-causal paths are all other sequences of arrows between the two. For example, a non-causal path can look like this diagram. Notice the arrows drawn in opposite directions. Non-causal paths play an important role in understanding association between treatment and outcome. They show how other variables may contribute to the covariation between treatment variable X and outcome variable Y. As a result, X and Y may be associated in the absence of causation. Let's say Z lies in non-causal paths. The first case is Z affects directly both X and Y. You already saw this diagram. It's one of the three basic diagrams of a dependency graph. It's called a common cause. Ignoring a common cause may result in a spurious association between treatments and outcomes. The second case, both X and Y affect Z. This diagram represents a common effect of treatment and outcome. We avoid stratifying non-common effects. Independent treatment and outcomes will appear associated within strata defined by the variable they both affect. And more general case is multiple arrows drawn in opposite directions. Now, let's go back to the diagram developed by Dr. Sheehan. The orange nodes here represent factors influencing both time to surgery and occurrence of death. Their influence could be direct or through chains of dependency. The orange arrows show the path of their influence. For instance, surgery type depends on the type of fracture. Arthroplasty is the treatment of choice for femoral neck fractures, and fixation is the common treatment for other fractures. This graph shows the surgery type affects time to surgery through resource availability. In turn, available resources mediate the influence of hospital type on timing of surgery. There you have it. The path from surgical timing to hospital death travels through patient fitness for surgery, fracture type, resource availability, and hospital type. And it's not causal. Now we're ready to tell what is causal diagram. It's a collection of nodes and arrows. Arrows show the direction of influence. You already know that, right? There are two designated nodes, treatment and outcome. And there is at least one causal path between them. A causal diagram may show direct influence of treatment on outcome. But remember, the direct influence of treatment is putative. In fact, it's the subject of causal analysis. Causes of treatment and causes of outcomes make up non-causal paths. They explain in part covariation between treatment and outcome. There are three basic dependencies in non-causal paths. A chain shows a mediating node between two nodes. Common cause shows a mutual dependency of two nodes on a third. And finally, common effect shows a node mutually affected by two other nodes. A collider for short. Causes of treatment play a crucial role in the development of causal diagrams. They are pre-treatment factors. Now, event chronology is important here. Pre-treatment factors can only precede the occurrence of treatment, right? And they can be responsible for the difference in the treatment group's composition. Post-treatment factors, on the other hand, include mediators and colliders. Mediators influence outcome, but neither mediator nor collider can influence treatment. Sometimes, causal diagram is described as a network of direct effects. That could be misleading and inevitably leads to Table 2 fallacy. This fallacy is recognized by Wistrike in 2011 paper. Essentially, it's the presumption that one can interpret the effect of any node in the same way. To see why it's not true, let's take a look at this graph. Controlling for Z removes confounding in the effect of X on Y. But what does controlling for X mean for the effect of Z on Y? As you can see, X mediates the influence of Z on Y, but controlling for a mediator produces a biased total effect. Therefore, variation in Y cannot be interpreted as a total effect of changes in Z. When we account for X, this effect could be stronger, weaker, or entirely opposite to the total effect of Z on Y. Now it's time to learn about causal diagrams in the form of a directed acyclic graph, DAG for short. First, DAG is a causal diagram. What is the most important thing about DAG? Well, no sequence of arrows starts and ends at the same node. No loops, no cycles, acyclic. This diagram shows two designated nodes, treatment and outcome. It shows causal and non-causal paths. Causal in green, non-causal in red. All paths starting at the treatment node and at the outcome, or at a common effect. All paths starting at common cause and at the outcome too. Common cause, then treatment, then outcome, that's one. Common cause, treatment, mediator, and then outcome, that's two. And from common cause to outcome directly. As you can see, there is no loops here. Often though, the first attempt to develop a causal diagram leaves us with loops. How to remove these loops? The answer is a timed sequence of events. Event chronology may help to remove loops. Keep in mind, factors with the same name may appear at different times in the causation process. We disentangle the loops by adding the time index to their names. Of course, this will add new nodes to the diagram. In this example, variables are indexed to correspond to the time when they are measured. That K stands for the state of production process at given time Tk, and Xk stands for the controls measured at the same time. Do you notice that there are no cycles here? DAGs have been known in graph theory for a long time, but bringing DAGs to epidemiology is a big deal. It shifts the paradigm of control for confounding. Before, it was common to adjust for all available variables. With DAGs, we adjust only for factors that block other influences on treatment and outcome. Finding sufficient adjustment sets is the DAG's main purpose. In a nutshell, an adjustment set includes variables that minimize bias in the treatment effect size. Sufficient means we don't use more variables than needed. That's it for today's lesson. To summarize, the main message is causal diagrams show the effect of treatment on outcome through causal paths. Non-causal paths show how other variables contribute to covariation between treatment choice and the outcome occurrence. You learned that directed acyclic graphs don't have loops. What I really want you to take away from this video is understanding the paradigm shift that DAGs bring to health research. With DAGs, we only adjust for factors that block other influences on treatment and outcome. Be sure to grab your PDF for this lesson. Link in the description. Keep on watching.